So the background behind that is that oncologists should be able to assess patients for EGFR mutations and decide upon appropriate target therapies such as tyrosine kinase inhibitors, regardless of the patient's age. The objective from these authors was to determine if simulation-based education that addresses clinical practice gaps could improve medical decision-making for EGFR-mutated non-small cell lung cancer. So what their methods were is they actually created these high-fidelity online modules and presented them in a platform that allowed the learners to assess the patient and choose from an extensive database of diagnostic and treatment modalities, matching the scope and depth of actual clinical practice. They designed this with 2 identical cases, and all they varied between the 2 vignettes was the patient age of 51 versus an age of 67. And so the task of the participant was to establish the diagnosis, the severity of disease, and select the appropriate treatment. And along the way, while they're doing this clinical decision tool, they use this method called instantaneous clinical guidance, where there were clinical checkpoints with the participant where they're able to get feedback instantaneously on their decision making and therefore direct them in the right appropriate treatment strategy. So what the authors found was that that there were significant improvements in appropriate diagnosis with stage 4 disease, appropriate decision of activating EGFR mutations, and starting first or second line therapy with the TKI. However, the differences that they noticed were between the oncologists in sense of the patient's age. They found that patients decided differently whether the patient was 67 versus 51. And also, academic oncologists were more likely to accurately diagnose the older patient than oncologists in the community. So, the conclusions were that online simulation training that engages clinicians in authentic, consequence-free learning can result in accurate diagnosis and selection of evidence-based therapies. However, oncologists' practice setting and patients' age may impact their clinical decisions.